What are the risks of ERCP complications and hospitalization? Imagine a procedure that helps doctors see inside your bile and pancreatic ducts to diagnose and treat serious conditions like pancreatic cancer. That's what endoscopic retrograde cholangiopancreatography, or ERCP, does. While it offers valuable insights and treatments, it also has some risks that patients should be aware of. Most people recover quickly, but understanding potential complications helps ensure safety and proper care. The most common complication of ERCP is post-ERCP pancreatitis. This occurs when the pancreas becomes inflamed after the procedure. About 5 to 10% of patients experience this, with some studies reporting around 9%. Usually, it causes mild pain and can be managed with pain medications and dietary changes. However, in some cases, pancreatitis can be severe, requiring hospitalization and intensive treatment. The risk increases because the pancreatic and bile ducts share an opening, and manipulation during ERCP can activate pancreatic enzymes prematurely, leading to inflammation. Another potential issue is infection, specifically cholangitis, which is an infection of the bile ducts. This can happen if bile drainage isn't fully restored during the procedure. The risk of cholangitis is estimated at around 6%. When it occurs, patients might need antibiotics and sometimes intravenous therapy in the hospital to clear the infection. Bleeding is also a possibility, especially if tissue is cut or stented during ERCP. Bleeding can be mild or severe and might requiring additional endoscopic procedures or blood transfusions to control. Though rare, perforation is a serious complication where the wall of the duodenum or bile ducts tears. This can cause leakage of intestinal contents into the abdominal cavity, leading to infection and often requiring emergency surgery and hospital stay. Other risks include allergic reactions to sedatives or anesthesia used during the procedure. Many patients experience temporary side effects like sore throat, bloating, or tiredness, which are generally not serious. Most ERCPs are performed on an outpatient basis, meaning patients go home the same day after recovery from sedation. However, if complications such as pancreatitis, infection, bleeding, or perforation develop, hospitalization becomes necessary. Sometimes, patients are admitted overnight for observation, especially if they had therapeutic interventions or have risk factors for complications. In the context of pancreatic cancer, ERCP is a vital tool for diagnosing blockages and relieving biliary obstructions caused by tumors. Yet, because patients with pancreatic cancer may already have weakened health, the risks of complications need to be carefully considered. Skilled specialists perform ERCP to minimize these risks, and close monitoring after the procedure helps catch any issues early. Overall, the main risks include pancreatitis, which affects about 5 to 10% of patients, infection, bleeding, and perforation. While most complications are manageable, some requiring hospital care and intensive treatment. Choosing experienced healthcare providers, careful patient selection, and attentive post-procedure care are key to reducing risks and ensuring safe use of ERCP in managing pancreatic and biliary conditions. Always consult your healthcare team for personalized advice and to understand how these risks apply to your specific situation.